ग्रेन्युलोसाइट्स एंड ए ग्रेन्युलोसाइट्स. ग्रेन्युलोसाइट्स में कौन कौन सी होती हैं? अब बताने दो जिसको पूछा है. न्यूट्रोफिल्स, बेसोफिल्स, इओसिनोफिल्स एंड नॉन ग्रेन्युलोसाइट्स या ए ग्रेन्युलोसाइट्स. ये वी मतलब फॉर क्लासिफिकेशन वी यूज, बट we do not follow this classification further, क्योंकि इसमें भी आपके दिखते हैं, right? Okay. So according to me, if I will introduce this leukocytes, right? So I'll introduce that they are important cells for defense mechanism, right? These among them the neutrophils, they act as the policeman. ठीक है ना, पढ़ा है ना आपने कि they act as a policeman, like local police. मतलब पुलिस जो है वो आपके लोकल एडमिनिस्ट्रेशन को देखती है. देन यू हैव द बॉर्डर सिक्योरिटी फोर्सेस, आर्मी, all that. So that way we have the classification of these immune cells. No, now no. क्यों लेट आ रहे हो? नहीं, सॉरी और कुछ नहीं, जाओ और दरवाजा चिपका दो. So they are acting for, or they are for defense mechanism, है ना. Defense ministry is the part taken care of by the leukocytes or the WBCs. As the name suggests, leukocytes क्या मतलब हुआ? Colorless. They are colorless in comparison to RBCs. ठीक है, though they can be stained. जो हम stain use करते हैं, it can be stained. They can take acidic dyes or basic dyes depending upon their affinity, but as of their original color, they are colorless, right? Okay. So they are named so because they are colorless. They are nucleated cells. We know that platelets are also not nucleated. RBCs are also not nucleated. But this is very important feature of the leukocytes, because on the basis of number of lobes and type, we will be differentiating the different types of leukocytes, right? And play an important role in defense. Now this total leukocyte count varies with age. It is very high in newborns, right? And slowly it goes on decreasing, right? And then we have, as already told by your colleague, we have granulocytes or agranulocytes, but it is better to classify, not to classify them this. आप अपने याद करने के लिए इसको ऐसे classify कर लो, right? Okay. So agranular में we have monocytes and lymphocytes. ठीक है, monocytes are very less in number. The maximum number is of neutrophils. It occupies almost 60 to 70% of the WBCs. ठीक है, if you are preparing a blood smear, right, and you observe its 100 fields. 100 fields का क्या मतलब हुआ? Field का क्या मतलब हुआ? एक व्यू जो आप देख रहे हो अंडर द माइक्रोस्कोप, राइट, दैट इज वन फील्ड. So you have to count when you will be doing differential leukocyte count. TLC in itself is not sufficient enough. Only knowing that the count of WBC is increased is not sufficient enough. It has to be assisted with DLC. DLC is differential leukocyte count. ठीक है, it may be that because all the cells may be increased, but it may also be that a particular type of WBC is increased, right? How that one particular type of WBC may help us? That boy आपके आगे, सोहम के आगे. हमारी आंखें इधर उधर देखती हैं क्या? हाँ, नाम बताएं, बताएं आगे जो मैंने क्वेश्चन पूछा. क्यों? आंख खोल के किसने सोना बताया? सुन रहे थे तो क्वेश्चन बताएं, क्या पूछा हमने? हाँ, if there is an increase or reduction in a number of a particular WBC, what important thing it may indicate, or what conclude, मतलब what indication we may get from that? इंक्रीज हो रहा है या डिक्रीज हो रहा है, दोनों कुछ बताता है। क्यों करना चाह रहे हैं हम? मेरा क्वेश्चन ये है कि व्हाई वी वांट टू डू। हाँ तो हमने टीएलसी कर लिया ना, उससे भी हमें समझ में आ गया कि इधर इट विल बी मोर देन 11,000 देन इट इज इंडिकेटिंग टुवर्ड्स अ डिजीज, और इट विल बी लेस देन 4,000 अगेन इट विल बी इंडिकेटिंग टुवर्ड डिजीज। व्हाई वी नीड टू डू डिफरेंशियल? यही आपको बोलना है कि द डिफरेंट टाइप्स ऑफ सेल्स मे हैव अ increase in different particular disease, right? But then also we have a list of those conditions or disease, ठीक है? So we'll be knowing about them. So the least number of these cells are the basophils, right? बेसोफिल्स बहुत मुश्किल से दिखती है, तो अगर आपको डीएलसी जब करने दिया जाए तो डोंट बी इन अ हफ एंड पफ टू mention it as a basophil, right? 0.5 to 1% है, less than half cell in 100 fields what you will be observing in differential leukocyte count, right? So these are the normal range. कभी भी आपसे ये परसेंटेज ऑफ WBC की हमने बात की थी, ये एब्सोल्यूट काउंट है, right? When you will be doing your this differential leukocyte count in next few practicals, then you will be learning about, so always tell the range, ठीक है? ये मैंने अपने फर्स्ट लेक्चर में भी बोला था कि always tell the range, and again I am saying कि कभी भी आपसे नॉर्मल वैल्यू किसी भी चीज की पूछी जाती है, always tell the range, right? Okay. So leukocytosis is the general term for increase, जो कि आप TLC से बता सकते हैं कि yes there is leukocytosis. What is leukocytosis? Increase in the count of WBCs. कितना increase? ये inappropriate answer था, right? कितना increase? How much? हाँ? Above 11,000. Above 11,000 it is leukocytosis. I'll be coming to another term that is leukemia, right? But abhi nahi. So these are the physiological. Then always when you tell about the cells, है ना, increase in their number or reduction in their number, you have to divide the causes as physiological and pathological. So physiological causes can be stress, can be exercise, right? Can be food intake, right? It is pregnancy also, right? And pathological causes can be any type of acute bacterial infection. कोई तो टाइप ऑफ सेल इंक्रीज कर जाएगी ना, अभी हम डिफरेंशियल पे नहीं आए, राइट? देन देयर कैन बी एक्यूट हेमरेज. इट कैन ऑल्सो लीड टू increase in leukocytes, burn and tuberculosis. Now the question arises, why these cells will increase with exercise or stress? Anyone? हमने बताया था 7 दिन लगते हैं WBCs को बनने में, 7 to 10 days. आरबीसी सॉरी, है ना? इसको भी लगभग उतने ही लगते हैं, ठीक है? Because they are also formed from the hemopoietic stem cells. Now my question is, what is the physiology behind increase in this number of WBCs, that is leukocytosis, because of exercise or stress? अगर मैं अभी किसी से क्वेश्चन पूछूं तो वो भी स्ट्रेस में चला जा रहा है ना कुछ लोग. वो बताओ प्लीज. एनी गेसेस, एनी सजेशंस, एनी, क्या सोचते हो आप? तो इतनी जल्दी तो नहीं, आप तो एक्सरसाइज करके खत्म कर दोगे ना, बोन मैरो इतनी जल्दी तो मैच्योर करके सेल्स को बाहर नहीं भेज देगा, है ना. These cells, not all the WBCs or neutrophils, most of the time it is neutrophilia, right, are in the circulation. Many of those WBCs are marginated inside the vessels. Marginated मतलब कि अगर ये vessel है तो यहाँ चिपक जाती हैं, pavement बना लेती हैं. They are not into the circulation, so they will not be accounted of when you will be taking the blood sample. But अब आप exercise करके आओ, ठीक है. Exercise की वजह से क्या होगा, these marginated cells, because of the increased blood flow, they also come into the circulation. Again take the blood sample and you may register a change. अब एक्सरसाइज का मतलब ये नहीं है कि बस नीचे से ऊपर आ गए 4 फ्लोर सीढ़ी से और हो गया, थोड़ा सा मॉडरेट टू सीवियर एक्सरसाइज, राइट. ओके, now there is another term, that is pynia. Pynia, you all know, is the reduction in the count of the cells. So a general term which is used for reduction of these WBCs as total, if we talk about TLC, then it is leukopenia, right. So infection of non-pyogenic bacteria like typhoid and paratyphoid fever. Then viral fevers, viral infections like influenza, smallpox, mumps. Then there are protozoal infection. Starvation and malnutrition में भी leukopenia हो जाएगा because synthesis कम हो जाएगी, right? Then we have aplasia, aplastic bone marrow, and depression, bone marrow depression due to the drugs, right? So these are the reasons which may cause reduction of the WBCs in total, right? Okay, now these cells are formed from the hemopoietic stem cells, we all know, and mostly of myeloid series that produce, we discussed in previous lectures that we have a myeloid and a lymphoid series, right? And most of these WBCs are also formed from the myeloid series, ठीक है? And this myeloid erythroid ratio is about 3:1. But in blood, the number of RBCs is far more as compared to WBCs. This is because of lifespan of RBCs in circulation. ठीक है, बहुत सारी WBCs, we'll be learning that monocytes also go into the tissues and they form macrophages and they stay there for months. Neutrophils also become marginated, ठीक है. तो बहुत सारी ये सेल कम देर के लिए सर्कुलेशन में रहती हैं, but then they go into different places where they stay for a longer duration of time, right? Okay. So this you all are knowing, but yes, you should learn it further. Anyone who can describe this? That girl, what she is writing, what you are writing? क्या लिख रही हो? Yes, you. तो उसके बाद वाली जो स्लाइड में है वो तो तुम देख ही नहीं रही हो. सुन तो लो, उसको शॉर्ट में लिख लो, बुक से जाके देख लेना, पूछ लेना हमसे आके. उसके बाद वाले में सब में उसको फॉलो ही करती रह जाओगी तुम तो. ये पढ़ के बताओ मेरे को, एंड व्हाट इट इज. दिस इज अ फ्लो चार्ट, राइट. जब भी आप लॉन्ग आंसर्स लिखते हो ऑफ 10 मार्क्स, सपोर्ट योर आंसर्स विद फ्लो चार्ट. इट गिव्स अ क्लियर. उसके बाद आप पॉइंट वाइज 1 2 3 4 लिख सकते हैं. यू नीड नॉट राइट 10 pages, but you should write effective 4 to 5, मतलब जो भी है, this is an approximate, but it should contain the entire content. Giving a flow chart, let us know, or the examiners know that yes, the student is at least knowing ki what. So can you please, what's your name? Shrishti, please explain what is this given in your flow chart. We have already discussed these are the different lineages. So what is it? Okay, so we have a pluripotent stem cells from which any types of hemopoietic um, cells can generate. Then these are divided into two types. One is myeloid stem cells and the lymphoid stem cells. And we see that in the myeloid stem cells, we have the colony forming units for the erythrocytes, for the granulocytes and monocytes, which further divides into two colony forming units, that is granulocyte as such, which is leading to the formation of neutrophils, basophils, eosinophils, and the other lineage which is giving uh, uh, it is leading to formation of monocytes, right, and the megakaryocyte as well, right, which are platelets. And then we have the lymphoid stem cells which are responsible for the lymphocyte cells. ठीक है, बैठ जाओ, बट फॉलो योर ओन. उस स्लाइड को छोड़ दो जो नहीं फॉलो कर पाए, बट उसके आगे का तो फॉलो कर लो, उसको बाद में डिस्कस कर लेना. चलो नेक्स्ट. नाउ दिस वाज द सिंपल फ्लो चार्ट, राइट. ठीक है, but we have certain precursors, certain growth factors, certain initiators which are important for formation of these cells, and these include the specific hemopoietic growth factors. We have a list of this. I'm not going in detail of all this, but for if you are describing the formation of a particular cell lineage, then you need to mention these growth factors, like erythropoietin for the erythrocytes. For platelets it is thrombopoietin. For the eosinophils it is specifically IL, matlab full form interleukin 5 and 3, right. These are all cytokines, right. And then for different this neutrophil macrophages, we have growth factors, colony stimulating factors for granulocytes and monocytes. So these are the different cytokines which are important for growth of the different lineages of the cells. And this is the complete flow chart, including itta nahi so manav. This is the flow chart which is expected from you when you are describing the formation of cells. ठीक है, okay. So colony forming units, they are the progenitor cells and develop to form committed stem cells. Committed, ठीक है, different colony forming units of different cell lines possess qualities of a stem cell. Further, they form the blast cell. As already we have discussed that these are the earliest morphologically distinguishable precursor cells of WBCs. ठीक है, जहां पे ये blast cells बन जाएंगी, इसके बाद ये specific lineage की cells ही form करेंगे, right? Okay. Then we have the promyelocytes and promonocytes which develop from blasts. Nucleus is round, condensed, and fewer nucleoli are there. And further, these promyelocytes are larger than the blast cells and contain the granules which are specific for different types of these granulocytes, right. So in general, the formation of these, if you see, these are the myeloblasts, right. Once these committed cells have been formed, they will be forming the promyelocytes of different lineages. This promyelocyte is for eosinophil, then this is for the basophil, this is for the neutrophil. This further develops into a further it acquires specific types of granules. ठीक है, granules में specific enzymes, proteins, they all are acquired inside that, and further they form the band cells and the mature type of a specific type of a WBC. ठीक है, so these are the different stages in this. Now, one important thing in this formation of neutrophils, neutrophils are having the मैक्सिमम नंबर ऑफ लोब्स, है ना. न्यूट्रोफिल्स में मैक्सिमम नंबर ऑफ लोब्स है 2 to 6. If you have gone through the anemia from your books, you must have come across that in vitamin B12 deficient anemia, the neutrophils becomes hyper segmented. ठीक है, इसका क्या मतलब हुआ? They become hyper segmented. This is one of the features when we examine, apart from macrocytosis in the blood picture, peripheral blood smear, we also find hypersegmented neutrophils. What is the reason behind? Anyone? Okay. How many of you went through this statement in your books? बस यही 3-4 लोग पढ़ाई करेंगे क्या? बाकी लोग स्लाइड्स ही कॉपी करते रह जाना. क्यों हो जाता है हाइपर सेगमेंटेड? एनी रीजन, फिजियोलॉजिकल बेसिस बिहाइंड दैट? बताओ. Yes, they are responsible for further cell division, है ना, but that is not occurring effectively. So it is not occurring effectively in all the types of cells, right? So this neutrophils becomes hyper segmented. The larger number of cells, most of the time if you do only the neutrophil counts, ठीक है, अगर आप different types of lobes of neutrophils का count करते हैं, उसको हम आर्नेथ count कहते हैं, right? कि कितनी neutrophil have 2 lobes, how many neutrophils have 3 lobes, how many are 4, 5, 6, like that. So most of the time the maximum percentage of cells is of 2 to 3 lobe neutrophils, right? But in case of hypersegmentation, the number of cells with higher number of lobes, that is 5 and 6, will increase, right? Their percentage will increase. Okay. So this part I am leaving it as to you as a homework, that you will be drawing the entire diagram of that hemopoietic stem cell to formation of different lineages of cells along with the different growth factors, right? Cytokines and everything required for formation of different types of WBCs. So it should be in your notebooks. This slide was included just to show you that how this differentiation proceeds forward. Like we have the colony forming units for granulocytes as well as monocytes. So they have divided that this will be forming only the monocytes for the monoblast it has formed, and it will move ahead to form the monocyte, right? While the granulocytes are divided further into the neutrophils, eosinophils and basophils lineages, right? So this was only to let you know that. Now coming to the most abundantly present cells in the blood, that is the neutrophils. If we talk about the leukocytes, right? And they are the major defense against acute pyogenic bacteria. Pyogenic का क्या मतलब होता है? Pus forming. ठीक है, all those bacteria which lead to like staphylococcus, streptococcus, these all are pus forming bacteria. You will be learning more about them in your microbiology, right? But there is increase this neutrophils, and therefore this neutrophilia, that is increase in the number of neutrophils only, right? हमने अभी तक क्या पढ़ा था? Lymphocytosis. Neutrocytosis नहीं है, it is neutrophilia. Increase in the number of cells is neutrophilia, and reduction in the number of neutrophils is neutropenia. ठीक है? Now what are the important characteristic features which you will be utilizing for identification in the peripheral blood smear? It is of the size of 10 to 14 micron, but you won't be able to measure it. तो you will be, किससे compare करेंगे हम इसको? RBC की cells से. So almost it is double the size of RBCs. ठीक है? we know that the size of the RBCs is about 7 to 7.2 microns, right? So ye almost uske double hai, right? So we'll be comparing it with that. So this is the size of the neutrophils. Then it has fine granules in the cytoplasm, ठीक है? कोर्स और फाइन का क्या मतलब होता है? कोर्स मतलब मोटे, मोटे दानेदार, एंड फाइन मतलब सिंपल छोटे 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 छोटे. फाइन मतलब लाइक सैंड पार्टिकल्स. दिस इज फाइन ग्रेन्यूल्स. कोर्स इज, क्या एग्जांपल दूं ईशा? कोर्स इज लाइक not like sand particles, but something bigger than that, right? So it is coarse, matlab you will be able to identify those particular points, right? Then the most important feature of this neutrophil is the multi-lobed nucleus. Now you can confuse it with if it is a bilobed. हमने बोला ना कि bilobular and trilobular neutrophils are maximum in number. So if it is bilobed, you can confuse it with the eosinophils. But eosinophils have a different colored granules and they are coarse granules. मोटे मोटे granules होते हैं, right? And this I have already told you that Arnett count is based on the number of lobes of the nuclei and what is the cause for hypersegmentation in megaloblastic anemia. Now there are different types of granules in neutrophils, and these granules contain specific contents which are important for the defense mechanism which is taken care of by the neutrophils, right? The first type is the primary granule and is also known as eosinophilic, and it is formed during granulopoiesis, and the important content is the peroxidase, right? Myeloperoxidase. It also contains the lysosomal enzymes, proteinase, alpha 1 antitrypsin. ये आपको याद करने पड़ेंगे, right? These the contents of the granules you will have to remember, right? Because in many of the diseases they increase and they are responsible for the destruction of our own cells, right? Then we have the antimicrobial proteins like cathepsin G, then defensins. These all increase the permeability of the this bacterial membrane. ठीक है? Okay, I am not going in this term of myeloid leukemia right now. We'll be dealing with it later. Then we have other granules which are secondary granules, tertiary granules and secretory granules. The contents of all these are given in your books. Kindly go through it, okay? And you have to remember all these, right? The most important was of the primary or the eosinophilic granules. So these are the different granular contents of the neutrophils, right? So important function of the neutrophils is phagocytosis. I assume that you all are aware of this term phagocytosis. किसमें होता है phagocytosis? कौन से ऑर्गेनिज्म में आपने पढ़ा है? एमीबा में. So what is phagocytosis? क्या होता है? कैसे होता है? और उसको एंडोसाइटोसिस हो जाती है उसकी, एंड देन इट इज डाइजेस्टेड बाय कोलिजन ऑफ द ग्रेन्यूल्स व्हिच वर देयर. ठीक है ना? जो एक तो वैक्यूल बनाया उसने एंडोसाइटोस कर लिया, ठीक है, पर्टिकुलर ऑर्गेनिज्म को, राइट? एंड देन इट विल empty its granular contents in that particular vacuole, leading to destruction of that particular organism or antigen, I should say. So how this happens? The neutrophils are in circulation. तो ये phagocytosis क्या सिर्फ will only be in blood vessels? ऐसा तो है नहीं कि बैक्टीरिया खाली और any antigen will only be present only in the blood circulation. So we learned that these neutrophils are present as margination along the endothelium. ठीक है. Now wherever the infection has occurred, it will release certain chemical factors which may act as chemoattractant. Chemoattractant क्योंकि वो chemical है, chemical substances released because of the reaction which is occurring between the antigen and the जो बाहर से जो भी organism, जो भी infectious चीज आ रही है, and the body cells, it will be destructing that part and that will be acting, those substances will be acting as chemoattractant for these defense cells. पुलिस को कैसे पता लगता है कि यहाँ पे चोरी हुई है? कोई तो इन्फॉर्मर होता है ना. So that informer is the chemicals which are being released, right? Now what will happen? These marginated cells, they will cross through diapedesis. Now you all are aware of this term also, diapedesis. ठीक है. तो एंडोथीलियम से ये स्क्वीज करके बाहर निकल जाएंगी and then it will be chemotaxis. Now what is chemotaxis? Taxis mean टैक्सी होता है ना ट्रांसपोर्ट के लिए. पुलिस जाएगी कैसे? दौड़ते हुए तो नहीं पहुंचेगी भाई. अब कहाँ उनका पुलिस थाना है और कहाँ पे क्राइम हुआ है. They will go by some vehicle. That vehicle is the taxis. Those chemoattractants are providing the direction that the neutrophil should be coming over here. So this is chemotaxis, and these chemokines, मतलब all those chemicals which are acting as chemoattractants are known as chemokines. ठीक है. Kinetic means motion, right? So this is the leukotriene B4. Then we have, what is this? Complement factor 5. ठीक है. We'll be learning it in immunity. अभी next उसमें we'll be going towards that, because overall this defense mechanism का function क्या है? To provide immunity to our body, है ना? So that will be the applied part, and the different types of cytokines which are acting as chemokines for the chemotaxis. ठीक. Then what is term opsonization? बता भाई प्रांजल. वेरी गुड. कोई भी चीज अगर टेस्टी होगी तभी आप खाएंगे ना. अगर हम एक तरफ कल की सूखी रोटी रख दें और एक तरफ मैगी बना के चटाचट रख दें, तो क्या खाना पसंद करोगे? क्या खाना पसंद करोगे? मैगी. रोटी, सूखी रोटी कौन था? Who was? बहुत ही दानी है भाई. Anyways, so there are certain of the complement system which I was talking about. Many of the proteins act as opsonins. ठीक है. Opsonins, उसको हम opsonins कहते हैं, which make the particular external substance palatable for the neutrophils or macrophages. So these are opsonins and they facilitate opsonization, जो वो उसको engulf करके digest कर रहा है, right? So antigen coated by opsonins, immunoglobulin G and complements. These are the important opsonins: complement factor 5A and complement factor 3B. ठीक है. They are high quality opsonins, right? Then there occurs endocytosis. ठीक है. This you all know how it happens. And then there is killing of that particular bacterial cell, bacteria or any other organism for which this neutrophils is acting against, right? क्या हो गया? What happened? इतना स्लीपी कहाँ रहते हो तुम लोग? मुझे समझ नहीं आता है. Any problem? क्या बताया मैंने? बताओ. नहीं, ये मेरे को फिर से आप एक्सप्लेन कर दो. सॉरी, आर यू ओके? तो बताओ फिर. नहीं, मेरे को पूरा बताओ. हाउ द area where the defense mechanism is needed. How it is reaching? What's your name? Huh? Ayush. फ्रंट सीट पे बैठे हो, इतने रेस्टलेस हो, इफ यू आर हैविंग एनी इश्यूज, आप समझ में भी नहीं आ रहा है, इसका मतलब पता भी नहीं है, मेरे लिए बड़ा डिस्टर्बिंग होता है। बैठ जाइए, हम क्या कर सकते हैं, बता ही सकते हैं कि आप गलत राह पे हैं। ओके, then this killing, once it has been opsonized, it has been taken in by the neutrophils, it has to be killed. That mechanism can be oxidative, that pathway can be oxidative, that pathway can be non-oxidative. So it has been divided accordingly. This is the pictorial depiction of how the this margination and diabetes is occurring. There is one term, increased permeability. ये क्यों हुआ? हर्ष नाम है जो हमारा सीआर है क्या नाम है? हर्ष। हाँ बताओ, इतना केयरिंग है कि आगे पीछे कौन प्यासा है उसको पानी भी प्रोवाइड कर रहा है। वेरी गुड क्लास रिप्रेजेंटेटिव। हाँ बताइए, why you think this in this diagram increased permeability? I talked from margination and onwards, right? Why this increased permeability and how is the permeability increased and why? हाँ, क्रॉस दी मेम्ब्रेन, लेकिन हुआ क्यों? वाई तो चलो ठीक है, हाउ, वाई इट हैपेंड? माय क्वेश्चन वाज वाई इट हैपेंड। जिसको पानी पिलाया उससे पूछ लो। व्हाट्स योर नेम? बैठ जाओ। हाँ, राघवेंद्र, बताइए why this increased permeability occurred? It will be leading to loss of fluid from the vessels. ठीक है, हुआ क्यों, हुआ कैसे? बताओ, बैठ जाइए राघवेंद्र। हाँ तो हुआ कैसे? Any infection is leading to inflammation. अभी in next उसमें when we'll be discussing about immunity, and this is one of the features of inflammation. कहीं पे आपने देखा है कि अगर चोट लग जाए, अगर it is not leading to bleeding, what happens? There is a swelling, है ना, there is वो एरिया, या कहीं पे अगर आपने बॉयल्स, है ना, बॉयल्स होते हैं अगर, तो उस एरिया को देखा, स्वेलिंग हो जाती है, रेडनेस हो जाती है, राइट? रेडनेस क्यों हो गया? ब्लड फ्लो बढ़ गया। ब्लड फ्लो कैसे बढ़ गया? परमिबिलिटी इंक्रीज हो गई। सो दीज ऑल आर दी साइंस ऑफ इन्फ्लेमेशन, कलर, डॉलर, ऑल दीज, ठीक है? So this was, and this is a defense mechanism. It is important. If it is happening, one thing is for sure, that your defense mechanism is acting properly, right? Okay, ha, it does not goes out of control and leads to something uncontrollable thing. We have to treat it at an appropriate time, right? So coming to the two mechanism which I was talking about, one is non-oxidative mechanism. Non-oxidative, as the name suggests, there is no utilization of any oxygen molecule, right? And it simply works कि degranulation of the granules. जो vacuoles से phagocytosis हुआ, particular types of granules will be degranulated, and the digestion of that particular or destruction of that particular organism or antigen will happen, right? ठीक है? Second is the oxidative mechanism. In this oxidative mechanism, the superoxide anions, they are acting to kill the this infecting organism, right? And these are formed by the membrane bound NADPH oxidase. What is the full form of NADPH? Nicotinamide इतना गुलगुल गुलगुल बोला, मुझे कुछ सुनाई नहीं पड़ा. डाई, अब नहीं कोई बोलेगा. एडेनिन. Okay, now this is acting in the presence of superoxide dismutase enzyme and leading to the formation of H2O2 as well as this active oxygen, right? And these two are acting against acting as a bactericidal agents, right? And these myeloperoxidase of neutrophils converts the chloride, bromide, and iodine and cyanides to their corresponding acids, which is again making the environment non-survivable for that particular organism, right? So this is the oxidative mechanism by which neutrophils are acting, and this is the non-oxidative mechanism, right? Now there are certain causes in which there occurs neutrophilia. Initially we talked about leukocytosis and leukopenia. This was in toto. Okay. Now we are talking about specifically of neutrophils, increase in the number of neutrophils, and it is known as neutrophilia. These are the different causes, physiological as well as pathological. You should know at least 2 to 3 causes of each. Neutrophil matlab increase in the cells, different types of cells, and reduction in those different types of cell. ठीक है, तो इसको आप पढ़ लीजिएगा. न्यूट्रोपीनिया में इट इज इंपॉर्टेंट टू नो दैट इन टाइफॉइड एंड पैराटाइफॉइड देयर इज रिडक्शन इन द नंबर ऑफ न्यूट्रोफिल्स. ठीक है, coming to the next WBCs, that is eosinophil, and the size is almost the same of that of neutrophils. The only difference is that it has a nucleus which is goggle shaped, so it is bilobed nucleus, and they have a coarse brick red granules. When you will be doing absolute eosinophil count, right, then you will be seeing that these eosinophils are filled with these pink color coarse granules, right, reddish pink, right? Okay, then again the important contents of those particular granules is very important. ठीक है, इसमें से सबसे important होता है major basic protein. ठीक, and this is also responsible in conditions where occurs eosinophil count increases in your parasitic infections, है ना, but increase in this major basic proteins because degranulation will be occurring frequently. ठीक है, this causes hyper responsiveness of the bronchial tree and these person often suffer from bronchial asthma. ठीक है, so this is, देखो है तो ये अपनी बॉडी का डिफेंस मैकेनिज्म, बट दिस इज लीडिंग व्हेन इट इज नॉट कंट्रोल्ड. अगर पैरासिटिक इन्फेक्शन को कंट्रोल नहीं किया गया, देन दिस इज लीडिंग टू अनदर पैथोलॉजी. ठीक है, so that is that, for that you should be vigilant enough, right? Then they are toxic against many intestinal parasites and specifically larvae, right? Then we have other proteins which is eosinophil. इनके contents please लिख के याद कर लेना. when we will be asking you will not be able to tell us the contents of the granules. ठीक है, तो इसको लिख लेना आप. eosinophil cationic protein which is rich in arginine and they are toxic against the helminthic parasites and tracheal epithelium as well. Then we have eosinophil peroxidase, then which is mainly active against the adult parasites, right? This major basic proteins for against the larval stage. ठीक है, इसकी भी पूरी बहुत बड़ी सी लिस्ट दी हुई है. You can at least go through it once or twice. Then we have eosinophil derived neurotoxins which has ribonuclease activity and they are toxic to the neural cells. Then there are other chemicals which are contents of the granules which include catalases, histaminases, then phosphatase, phospholipase D, all these, right? ये भी तो कीमो अट्रैक्टेंट्स की तरह एक्ट करेंगे ना, जहां पे जाके इओसिनोफिल एक्ट कर रहा होगा, डीग्रेन्युलेशन होगा, these all will be acting as chemo attractants as well, right? Then we have two other, apart from these granules, we have two other granules, with one of which contains cytokines, different types of cytokines, and then the other granule which is containing the lipid derived chemicals. So कितना सारा गोली बारूद लेके ये लोग घूम रहे हैं, राइट? इओसिनोफिल्स आर दी आर्मी पर्सनल्स वी कैन से, ठीक है? इतनी सारी चीजें ये साथ में लेके घूम रहे हैं, राइट? सो दे आर रिलीज एज पर दी रिक्वायरमेंट. Then again, they will be migrating to the tissues, which we have already discussed for the neutrophils. Then against the chemoattractants, and the chemoattractants for eosinophil are specifically known as eosinophilic chemotactic factors. ठीक? And two important defense mechanism against the helminthic and the allergic reaction. These two are important. ठीक है? क्योंकि हेलमिंथिक इन्फेक्शन के लार्वल स्टेज के अगेंस्ट भी उनके पास डिफेंस मैकेनिज्म है, एंड अडल्ट के लिए भी है, राइट? एंड फॉर एलर्जी एज वेल, राइट? सो आई एम नॉट गोइंग इन डिटेल हाउ इट इज हैपनिंग, इतना पढ़ के आना खुद से. देन वी हैव द बेसोफिल्स. दीज ऑल दी सेल्स आर ऑफ ऑलमोस्ट सिमिलर साइज, ठीक है? 10 to 14 माइक्रोन, राइट? एंड बेसोफिल्स एंड मास्ट सेल्स आप साथ में सुनोगे कई बार, बट they do not resemble, they are not identical, their functions are maybe same, but they are not identical. Mast cells are different and basophils are different, and they are heavily studded with granules, filled with granules, but they are of basic in nature, इसलिए हम इसको बेसोफिलिक कहते हैं. फिलिक means loving. So they take basic dyes, right? Stain with the basic dyes, and their granules are composed of histamine, chondroitin sulfate, then carboxypeptidase, leukotrienes, and this major basic proteins are less in amount, right? ऐसा नहीं होता है कि कोई एक इन्फेक्शन हुआ, दो eosinophil will be the major cells which will be increasing, but other cells will also increase, right? Then these are the conditions in which these cells increase. Basophils increase in most of the condition of allergies, right? Then comes the monocytes. Now these are the largest cells, ठीक है? Largest cells in circulation. Which was the largest cells in the bone marrow? Hemopoietic stem cell में largest हमने बताया था मेगा कैरियोसाइट्स, है ना? उसको लार्जेस्ट बताया था हमने. दीज आर इन दी सेल्स. आपको अलग से बड़ी सी दिख जाएंगी, बट इनका वेरिएशन देखो फ्रॉम 12 to 20 माइक्रोन है, राइट? सो इट कैन बी ऑफ द साइज ऑफ द अदर सेल्स, अदर WBCs एज वेल. द अदर आइडेंटिफाइंग feature, it is written second line of defense mechanism. What is the first line of defense? In the blood. First cells, neutrophils. Neutrophils are the first line of defense. Then comes the monocytes. These are the second line of defense, right? And the cytoplasm is abundant, and their nucleus is also very large, kidney shaped or indented. जो आपने वो राजमा देखा है, किडनी बीन्स, राइट? उसी शेप का इसका न्यूक्लियस दिखाई पड़ता है, या हॉर्सशू शेप भी दिखाई पड़ता है. इट कैन वेरी, थोड़ा सा वेरिएशन हो सकता है. एंड मोस्ट ऑफ द टाइम इफ इट इज ऑफ 12 to 13 or 14 micron, you may confuse it with large lymphocytes, right? So you have to be very cautious while giving the nomenclature or identifying these cells, right? Their half life is up to 72 hours, after which it enters into the tissues where it is stored for months as macrophages, ठीक है? And they are capable of cell division, and macrophages are still larger in size. ठीक है, so we also call it as monocyte macrophage system, right? Again, their function is almost same, that is phagocytosis and microbial killing, and they are, yes, they play a very important role as a antigen presenting cells. What I was talking about as macrophages, in liver they get transformed into Kupffer cells. ठीक है, in alveoli they get converted into which cells? Class cells, dust cells. Then in the neurons, in the brain they get converted into glial cells. So they have been in the skin, they are converted into dendritic cells, but they are acting as a antigen presenting cell. ठीक है, जब पुलिस के पास लेके जाना पड़ता है ना कि इसने हमारे साथ, या कंप्लेन लेके जानी पड़ती है ना, so these macrophages are acting as those presenting cells, antigen presenting cells, which play an important role for humoral immunity, which we'll be learning ahead, right? Okay, then coming to the last, that is the lymphocytes. Lymphocytes have different classification. जो आप peripheral blood smear में देखोगे वो small lymphocyte and large lymphocyte में classification है, right? Small will be smaller in size, of the size of RBC, almost 8 micron, and the nucleus of small lymphocyte will completely cover the cells. ठीक है, खाली एक छोटा सा आपको जरा सा वो दिखता है, साइटोप्लाज्म दिखेगा. Large lymphocytes are larger and they have slightly indented nucleus, जिसको आप कंफ्यूज कर सकते हो मोनोसाइट से. ठीक है, this is under the microscope, but they are functionally classified as B cells, B lymphocytes and T lymphocytes and NK cells. ठीक है, NK cells they play a role in innate immunity, while B and T lymphocytes are responsible for the cell mediated and the humoral immunity. ठीक है, we'll be learning about all these in the next, when we'll be discussing about next tomorrow only, right, for the immunity. Isha, can you please? आज जितना बोला है एटलीस्ट उतना आप अपनी कॉपीज में लिख के लेके आओगे, राइट?